Can I welcome back again Professor Tatjana Milenkovic from Macedonia, and she's going to talk about hypoglycemia risks and management. Professor Milenkovic is president of the Macedonian Diabetes Association and has vast experience in diabetes. Thank you for joining us.
Thank you so much once again. Now I will talk something about the hypoglycemia, which is one of the most frequent acute complications of diabetes and one of the greatest limiting factors in diabetes treatment. So since 1921, so this is 97 years after insulin discovery, the hypoglycemia is a major barrier in achieving the maximum potential of insulin treatment, and especially what is danger about hypoglycemia is hypoglycemia unawareness. So that's why the hypoglycemia is an insulin dark side. Upon that definition, what we are considering for hypo in patients with diabetes, hypo below 3.9 millimole per liters. But what is important that the hypoglycemia is, of course, the complications of oral treatment with secretagogues. It is associated with less than 1% annual risk of severe hypoglycemia. And in type 1 diabetes, it is associated with less than 5% of annual risk of severe hypoglycemia in patients with type 1. What is the real incidence in hypoglycemia between patients treated with diabetes is very different in different studies, but this is that I found something like average, that event rates for severe hypoglycemia range from 110 to 320 per 100 patient year for patients with type 1, and from 10 to 7 per 100 patient year for patients with type 2 diabetes. So, of course, it is more frequent in patients with type 1. And this is shown in many studies until now. The hypos, especially severe hypoglycemia, is more frequent in patients with type 1 diabetes. So what are the main risk factors for hypoglycemia in person that we are treating with diabetes? Of course, first is the previous history for severe hypoglycemia or history of hypoglycemia unawareness. Then, of course, intensive diabetes management, but our goal for HbA1c is near normal or even below 7 or 6.5%. Then longer duration of type 2 diabetes, and of course, concomitant use of insulin with insulin secretagogues. And this is from the studies. What is the causes of hypoglycemia in person treated with insulin? The first, when the insulin are given in combination with other glucose-lowering medication, when there is a decreased carbohydrate intake, when there is more physical activity, mainly increased glucose utilization, then increased insulin sensitivity due to losing body weight, and of course, decreased insulin clearance due to chronic renal kidney failure. So the most common identified hypoprecipitant factors were reduced food intake and administration of wrong insulin products in majority of the studies that I am aware of. The main risk factor for hypoglycemia is, of course, when we are targeting near normal level of HbA1c. And the ACCORD study showed this very clearly, that when we were trying to lower the hemoglobin A1c even below 6%, there is a major risk of hypoglycemia and severe hypoglycemia, 3.1%, and of course body weight, increase in body weight. But what was the most important? Increase in severe hypoglycemic risk in patients which are with hemoglobin A1C below 6. Also, this is a meta-analysis which shows what is the incidence of severe hypoglycemia in type 2 diabetes patients which are treated with intensive in comparison with conventional control, and of course those treated with intensive control, they have a higher incidence of hypoglycemia. Hypoglycemia rate is, of course, depends on different insulin regimes, and more frequent hypoglycemia is in basal bolus regime, then in biphasic insulin, and of course the less incidence of hypo is in patients treated with basal insulins. And for all of us who are treating diabetes, when we are treating them with insulin, it is very similar like walking a tightrope, because we are from one side a risk for hypoglycemia, from the other side the risk from hyperglycemia, and of course whenever we will lose, for patient it's not good to be majority of time in hypo and also in hyperglycemia, and so we need a real good balance between those two in order to preserve the quality of life for our patients and to reduce their risk for complication. One of the most dangerous forms of hypoglycemia is hypoglycemia unawareness due to autonomic neuropathy. The patients, of course, they are not aware of hypoglycemic symptoms, and then they cannot react on time to stop further worsening of hypoglycemic reaction that they are experiencing. So the hypoglycemia unawareness, what is important about it, it is the fact that this type of hypoglycemia is associated with higher risk for severe hypoglycemia, even 3 to 6 times higher risk for patients with type 1 diabetes. In type 2 diabetes, a little bit less. They have a 10% lower risk for severe hypoglycemia, but in those with type 2 with hypoglycemia unawareness, the risk of severe hypoglycemia will increase 6 to 7 times during even the standard treatment for the patient, and even in the higher level of HbA1c with this patient. And that's why we need for these patients a higher value of HbA1c in order to stop their risk of severe hypoglycemia. And other also very danger, it is situation, it is a nocturnal hypoglycemia which occurring during sleep. And it is quite often among the patients, and this was discovered with CGMS. Of course, the majority of patients even cannot feel this hypoglycemia during night, but with CGMS it was confirmed that there is an unrecognized hypo in maybe 60% of the patients, and majority of these hypos occurs during night. What is the great danger of this situation? Of course, the majority of problems are that hypoglycemia can affect the brain, and there is an association between this repeated severe hypoglycemic reaction and long-term cognitive dysfunction. This is especially in children and adolescents, which are, well, if they are experience severe hypoglycemic episodes, and of course, this severe hypoglycemic may aggravate the severity of the neurocognitive dysfunction in majority of patients with diabetes. In older patients, also severe hypoglycemic episodes, they are related or associated with increased risk of dementia, functional brain failure, and also cerebral ataxia. What is about heart? It is very well known that hypoglycemia can influence the blood coagulation, the inflammation and endothelial dysfunction. But what is even most important is the sympathoadrenal response to hypoglycemic reaction. During hypoglycemia, especially during hypoglycemia during night, there is a blunted sympathoadrenal response with parasympathetic contra-reaction, and due to this, there is a ventricular premature beats and bradycardia and atrial ectopy, and this can lead to fatal arrhythmia and very often to sudden death or death in bed, as we all know that it is often especially in kids and young person with type 1 diabetes. So until now there is a big number of trials, but particularly in ACCORD trial, they investigated the effect of intensive blood glucose control on macrovascular outcomes in patients with type 2, and this study demonstrated there is an increased rate of mortality in patients who are experienced very frequent the hypoglycemic episodes. So this hypoglycemia is very often associated with proarrhythmic state, and this can be in both type 1 and type 2 diabetes, and these hypoglycemic episodes can prolong the QT interval. In particular, they may lead to this tachycardia, fibrillation, and sudden death. And that is the main reason why the hypoglycemic reaction can be so dangerous for patients on insulin treatment. Normally, this fear of hypoglycemic reaction is one of the major factors that compromise the quality of life of patients with diabetes. Even it is equal or similar to those patients who are experienced complications related to diabetes. So this is a two-way correlation, because the patients who are experienced a hypoglycemic event, they have twofold increased risk for developing dementia, but also patients with dementia, they have a higher risk for hypoglycemic reactions, of course, because they are not so many aware of regularity of their food intake and insulin treatment. It should be because they are dementia affecting their normal eating and taking regular medications. What is the treatment of hypoglycemia? Again, we will come back to education. It is the main principle to educate our patient what are the possible risks of especially insulin treatment and treatment with insulin secretagogues, who are very well known, that also can cause very severe hypoglycemic reactions, especially in older people with kidney failure, because they can cause so severe hypoglycemic reaction that they can last even a couple of days. We have to provide education, and education with full remote access with phones, email, and every kind of possible relation with our especially young patients and children and adults here who are the most exposed to this risk of severe hypoglycemic reaction. One of the strategies which really can prevent hypoglycemic reactions are CGMs or continuous glucose monitoring, and the new pumps which can alert our patient that they have hypo or the tendency of their glycemia to go lower and lower, and even to stop the insulin delivery. And in that case, there are the strategies they really can prevent severe hypoglycemic, especially in children and adolescents with type 1 diabetes. Some of new treatments and new anti-diabetic medication, of course, with little or no risk for hypoglycemia in the future, or maybe today for some countries. They can reduce risk of hypoglycemia. And what is, of course, very important, we have to empower our patients regular to perform self blood glucose control, because it is the strategy that they can follow their blood glucose regulation, and they can act upon their blood glucose measurements and to avoid risk of hypoglycemia. And finally, these slides I would like to show what is the risk of what the medications are with the great risk of severe hypoglycemia. So of course the sulfonylurea, there are the medications that they are causing the mild or even severe hypoglycemia, especially in older population, as I told you, and this risk is 4 to 6 fold higher than those treated just with metformin, and 3 to 9 fold higher than with TZDs. Of course, the meglitides is also with a higher risk for hypoglycemia, and the combination when we are combining even metformin and TZDs with sulfonylurea, there is a still risk of hypoglycemia, and of course we should be aware of this complication when we are treating especially older people with oral medication that can cause hypoglycemia. So in conclusion, I would like to say that hypoglycemia sometimes is neglected complication of diabetes treatment, but it's still a complication that is have consequences far beyond clinical moments, but also economical. It has a great social impact. So the mild hypoglycemia will reduce the quality of life among the patients but severe hypoglycemia, it's a life-threatening condition, and of course it can precipitate the major cardiovascular and cerebrovascular events in patients with diabetes. So in order to improve this acute complication, we should educate our patient properly, and of course we should avoid as far as we can sulfonylurea secretagogues in older patients, and we should treat patients according to their age and risk, and to choose a proper insulin and insulin treatment and HbA1c target goal for each patient upon his after that we will consider about risks, his risk that he's having when he's on insulin treatment. Thank you so much.